All right, so for this assignment, we will be taking down or gathering information on a client's injury. That would be taking their history, which is HIPS or HOPS, using sample and using OPQRST to gather useful information to see what we can do to treat, rehab, and get the client back out on the field. At the moment, I don't have anyone to do this with, so I'm gonna be doing this with my dog, Red. He's gonna be a good patient. Red is gonna be in here with an ankle injury, AKA his paw. And we're just gonna take down the history of it, any pre-history information, current history information, and anything that we would do for a real patient. And I'm gonna be using my notebook right here just to make sure practicing my in-clinical trials. So I don't have any information around here, but as I write down information, I'm gonna do the hits, and everything like that as if I would do in a real clinical setting. All right, so our patient is Red, and he said he has came in here because his paw/ankle is hurting, it's a little sore and stiff. All right, Red, up, come here. All right, so Red, for your right paw, have you ever had any past injuries, sprains, anything like that with that? Seems like you have not. Only thing you did is lost a nail, but that is all good. That is all good. Right, and then your current history. Before this incident, were you have anything that was leading up to the incident, such as soreness or anything like that before you sprained it? No, so we just woke up, we're practicing, and you sprained it at practice. Okay. May I look at your paw? Sweet. All right. May I test the range of motion? All right. We got good full range of motion. All right. This was a person I would slightly or gently push down on their nails just to get that, see if they have circulation going on right now, and then test their range of motion, make sure nothing's too stiff or anything like that. And then just kind of look for take an observation look, but looking for things that will stick out and is part of the injury. Like it could be a big bump on his ankle or his paw that can slide, that is a big bruising or something like right there. All right, all right. And then palpitations, I would just feel for everything. There could be some spots on the patient where you're just feeling around their wrist or ankle and you don't see an injured spot, but when you touch it, they flinch back, which is indication of that spot is injured. And even though you can't see it or it could be a slight touch, it still could be very painful to the client. All right, so after we do that, we see if we need any special tests or anything like that for Red. Maybe for a patient with a sprained ankle or maybe a sprained ankle would probably be depending on how the sprain is. So if it just happened and it's swelling up, you would put ice on it to control the throbbing. But if it's been a couple days and it's a little stiff and everything like that, we would do a heat pack or something like that to get the range of motion and stiffness kind of away. And then determining on the treatment and test to go even further than that is just depending on the AT and what their specific goals are and values for that person is. All right, so now on the history part, we'll take down the information of how this incident occurred. This acronym is called OPQRST, which gives us a good information on the incident at the time it happened. So for OPQRST, the O stands for onset. Excuse me, Red, get up real quick. Up. So, onset, Red, how did you hurt your paw? Oh, you were playing at the park and you just ran, and when you jumped up and you landed, it just felt like it went sideways. Okay, onset. All right. And then provokes you. So is there anything that provokes it to hurt or gives you a little pain or anything like that? This is my information. So you're saying just when you put pressure on it or any type of weight on it, it hurts, starts to feel a little too much pressure or too much pain. All right. Can't walk on it, you said? Okay. All right. And how would you say the quality of pain is? It's very... How would you describe your pain in a short essence? Okay, so it's bearable, but every now and then when you put too much weight on it, it's very sharp and stabbing pain. Okay. All right. And then for the region of your pain, it's in your ankle, right? Perfect. Now, is it just in the ankle region, or do you feel it coming up to the shin and maybe to the back of the calf or anything like that? Nope, just in the ankle region. That's good. All right. So when I touch back here, you don't feel no pain. Touch the knee, you don't feel any pain. Okay. All right. And then for the severity of it, on a scale of 0 to 10, how would you rate this? 0 being you don't need to go to the hospital, and 10 mean you need to go immediately. Like, I need to drop everything and get you going right now. Okay, you'll say about a 5, so it's not too painful to go to the hospital, but you want something done with it. Okay. Makes sense. And when did this happen? All right, so this happened about 2 days ago. All right. Perfect. All right, so this happened 2 days ago. Let me check it again. 2 days. The swelling is not the worst, so that's good. Okay, sweet. All right, and then for symptoms, the next one is going to be sample, which is symptoms. I gotta write it down. Symptoms, allergies, medications, past history, last meal, last oral take, and events that led up to this. All right. So symptoms or signs or anything like that. I don't think... The only symptoms that we have is you're just limping and you can't put weight on it. So limping. All right. Do we have any histories of allergies or anything like that? No, we do not. All right. Do we take any medications or anything? Are we prescribed anything, sir? No, we do not. All right. Do we have any past medical history? You had surgery for the nail on that foot. Okay. We just had surgery on that foot for the nail, though. All right. Excuse me, sir. We're not done yet. Up. Sorry. Almost done with your evaluation, sir. All right. So events that led up to this. We were at the park. We were we were going for a walk at the park, and you saw a squirrel, and you went to go chase it. And you said as soon as you jumped, it felt good, but as soon as you land, you felt as if all your weight went into your right ankle. All right. Events. All right, sir. Perfect. All right. We got all the information that we needed. The AT will be right with you when they can. Thank you.